today about the virtual patient. And when I talk to you about the virtual patient, I'm going to take you back to the time when the internet began. In 1992 was when the Maastricht Treaty was signed. It was the end of the Cold War, the end of apartheid, and a computer looked like this at the time. Now, for those of you who can't calculate, this would store about 10 photos or one 5-second video. And in this time, in order to access a computer, you had to go to it via MOS-DOS. And for those of you who are young enough may remember trying to program this and getting it to work. Now, if you can imagine in this scenario, I remember the day that a friend of mine, Rob, who was studying at the University of Bristol, he was talking to a friend of his in the States via this thing called email, this online method of contacting. And I remember the day he jumped about with excitement when he managed to send a message. And I remember thinking that this would be limited to Rob and his friends. They would be the only people using this internet thing. How wrong was I? What we know is from Rob and his friends in 1992, the internet has grown to 45% of the world's population having access online. We also know that certain nodes contain a lot of people. We know that there are 1 billion people, or 1 in 7 of the world's population on Facebook. We also know, as well as people being online, they're spending more time online. In the UK, we spend more time online than we do sleeping. We also know, those of you who have teenage children, it won't surprise you to know that the average teenager spends about 27 hours a week online. So with all of these things, we're spending more time online, and the types of time we spend online depend on the type of patient. We find that our older patients will visit certain sites and spend time on certain areas. Our younger patients will spend time in slightly different areas and be more comfortable with sharing different information online. We also know that if you aggregate the amount of time we spend per day on different sites, and then you combine that and you put that into a lifetime's worth of time, we know that if you look at common activities such as socializing, rooming's on there, eating and drinking, and social media, if you put that all together in your lifetime, what this tells you is you're going to spend more time socializing with people on social media than you will in real life. Now you know this, what you need to be aware of is most people are happy sharing data in the cloud. They're happy having their data shared in the cloud. And what we need to ask ourselves is, with this generation of people where we're happy online, we're happy in the cloud, how do we think about healthcare? What do we think of healthcare? And what we know is that our patients are used to wearing things like trackers on their arms, collecting data about that. We know that there's lots of different places in which you can wear your trackers, on your ear, around your chest, there's necklaces, and there's 325,000 different mobile health apps on the App Store. So with all of this, what else can we do? What else do our patients want? Well, they want more than that, actually. What they want is they want to collect data on the outer shape of their body. This is something you can sit on that will look at your body and scan to see if your latest fitness regime is working well for you. And if it is, it will give you feedback on if you're eating too much or not exercising enough. It gets even better because you can go and get your own blood test. You can order your own blood test online. Having ordered your blood test online, what you can then do next is you can go and have your own MRI. Having had your own MRI, what you can do is you can keep all of that data yourself and choose to share it with your doctor or not. So this means that our patients are thinking about their health in a very personal way. And what we need to ask ourselves is, what's the implication for dentistry? How do we get our patients virtual? What we know is that in every time we think of our health according to the things that are available, we know that in 200 years ago, the body was thought of as a mechanical thing. We now think of our body in a very different way. We think of it as something that can be regulated, optimized, and enhanced through data. Our patients are used to data, and we're used to data. And alongside this, we need to learn, as dentists, to virtualize our patients. We virtualize our patients and exchange information using 5 different layers of information. The layers of information that we use are clinical photographs, both intraoral and extraoral photographs. We also use radiographs as well as radiographs. We use CT scans, and we can use this for planning. These are all the things that Alberto has talked about earlier. And alongside this, we then integrate this with intraoral scans. And the final piece of the puzzle is we add facial scans. And with all of these 5 layers, what we do is gather these 5 layers, put them into a package, and this package allows us to start to design how we want our patients' restorations to look. And we use a package called Digital Smile Design. And this is a keynote document that allows you to combine the different layers of information so that you can produce a digital wax-up of the patient. This digital wax-up of the patient can then be combined with a facial scan of the patient so that you have all of the layers of the patient. You've got the facial layer with the facial scan, you've got the intraoral scan, you've got the CT scan, you've got the wax-up, and these 5 layers of information can be combined in order to produce your virtual patient. What are the benefits of the virtual patient? Well, for us as dentists, the benefits are it allows us to diagnose better. Being able to see the patient in your own time and away from the practice allows you to diagnose better. You're able to communicate with your laboratory better. You're able to communicate with the patient much better. And by doing all of your planning outside of the mouth, this reduces your treatment time, improves your predictability, and also gives you an element of quality control. How about for the patient? This is all very nice for us, but our patients benefit in the same ways with better communication, which leads to better consent and understanding of the process. There's a way in which they start to appreciate the work that's going to go into their restoration by being able to see how you're planning to put their restoration together. And by understanding the value of what we do, this overcomes some of the barriers that we come across, which are barriers to payment. For the technician, getting them involved in the case from an early stage is very useful. They understand and are able to direct us in the right way. And also, if we look at it from the specialist point of view, having other specialists involved in the case and having them able to diagnose and contribute to the treatment plan is very useful. And finally, we also need to remember that there is the patient's decision maker. The patient's decision maker, being able to show them all of this information and get them involved in the case is a very important part of getting consent to go ahead and also of getting the patient to go ahead with treatment. Let's start off by let's continue by showing you a case. This is a lady who's come in and she's she's fractured her upper right 3, and that's her main concern, is to treat that upper right 3. What we're able to do is take a series of photographs and start to show her the problems, and from showing her the problems and putting together potential solutions in 2 dimensions, we're able to get her to understand a little bit about what's possible. Going a little bit further in this case, 2 dimensions is one thing, letters are another thing, but having the patient able to visualize what it is we're planning on doing in terms of their treatment is invaluable. So in this case, what we're doing is we're plotting the midlines, we're plotting the interpupillary line, we're plotting the smile curve, we're putting a set of teeth in place, and having put a set of teeth in place, we're then able to put some other shells in place which show the patient what they might look like. We do this on a micro level, and then we do it on a macro level, closer into the teeth, so that they are able to see what's possible. We produce a diagnostic wax-up. Having produced a diagnostic wax-up, we then produced a shell. This shell is used alongside the CT scan and planning, so that we're able to plan for all the treatment before the patient comes in, and show them what's possible before we actually start treatment. Treatment in this case, sometimes we can use a guide, in this case we haven't, and there's some research that Alberto talked about to do with guides and patients' pain perception. But treatment in this case involved extraction of the teeth, having extracted the teeth, placing the implants, having placed the implants, making a welded framework, having made a welded framework. From there, what we've been able to do is to pick up the welded framework and make a prosthesis for the patient. Having made the prosthesis, we then leave the patient to heal, we improve oral hygiene, we work on the patient, on them understanding what the potential complications are of not cleaning, and from there, we then have a review, because we need to look now and do some quality control. Is what we planned what we've got? If what we've planned is not what we've got, we have a new canvas, which looks very different to where we started. And this new canvas is something that we can then use to wax up again digitally using natural shapes and textures to take the patient through the digitization process again and select a different set of teeth for the patient based on natural tooth shapes and textures, which we're then able to transfer information from the digital to the physical in the form of a model. This model is then, again, tried into the patient's mouth so we can see what it looks like before we order a long-term provisional, which is there. And the long-term provisional, once we've got that in place, we're able to put that into the patient's mouth and show them where they started, the long-term provisional restoration, and in the middle you can see the chair-side provisional restoration. And this sort of restoration allows the patient to see what's possible, and also through virtual planning we've been able to take the patient through the steps and also do the aesthetic planning that's necessary to achieve this result. But there are challenges to this. The challenges that we face with this is we have to transfer information from a 2D screen to a 3D patient. And the challenge of this is we're dealing with something where we're just laying shapes onto a screen, and we have to make a physical thing for the patient, a prosthesis. And you can see here, when we've gone through the same process, the midline in the middle picture is out. The midline is out, and we've been able to correct that and order another wax-up or diagnostic for the patient. We also need to bear in mind that with all of this digital stuff that we're showing, you still have to carry out surgery. There is still biology that's important. There's still cleansability that's important. You need to be able to do it in the physical world in order to do it in the digital world. And just being able to plan it is not enough. There's also a way in which we need to learn about reading digital models, because looking at this wax-up you see here, looking at the 2 iterations of it, it's hard to see which one will be better for the patient. And using measurements, as we can do on the digital, and using measurements allows us to plan and plot where we think the teeth are going to end up in the correct aesthetic place. And again, the transfer of the information from what we plan to where we're planning on having the patient happens in this stage. This is called the mock-up. This is transferring the wax-up from the digital to the physical world. And one of the bits of technology we're able to use that makes this much, much easier is shown on the top left-hand side. What we've got there is you've got the patient at the start, you've got the digital wax-up and DSD process, you've got the patient's face scan, and on the bottom right-hand side you can see the integration of the patient's face with the CT scan, with the intraoral scan, and with the wax-up. You can see the implant planning, and with this we now have the patient prepared for surgery. How does this benefit the types of patients that Sven, Alberto, and Ernest have talked about? This benefits the informed patients by being able to show them what's possible. By being able to by them being able to see what's possible, they can sometimes have a better understanding of the treatment. And by having a better understanding, we know that they have a better expectation of what's possible. We also know for the elderly patient, getting them to the shorter treatment times and more predictable treatments through planning before the patient is there is a benefit to them. We know as much as the elderly patients might want functional treatments, being able to plan the aesthetic proportion as well as the functional at the same time is a real benefit to the patient. And for young patients, it's the aesthetics and the long-term predictable treatment that we can get from planning the patient virtually and spending the time outside of the patient's mouth rather than doing the treatment inside the patient's mouth. What technology is going to make an impact on what we're doing in the future? The 2 things that I think are going to make an impact are blockchain technology and artificial intelligence. If we look at the first, if we look at artificial intelligence, what I'd like you all to do is just listen for a second. This is a phone call.
So how can I help you? Hi, I'm calling to book a women's haircut for a client. I'm looking for something on May 3rd. Sure, give me 1 second. Sure, what time are you looking for around? At 12 p.m. We do not have a 12 p.m. available. The closest we have to that is a 1:15.
What you've just heard is a robot, artificial intelligence, making that phone call. It made it to make a hair appointment. How long before Google, our system, starts calling your office to make appointments? It doesn't involve much effort from the patient. You just need to program that in and it will call for you. And the person at the other end will not have an idea. The other bit of technology that I think is going to make a difference is this, which is blockchain technology. What this allows is records, medical and dental records, to be written by a specific person at a specific time and then added to a ledger. And as they're added to the ledger, one owner has the key, which is the patient. So the patient potentially can move around lots of different offices, and moving around lots of different offices, they have access to all of their dental records, so you don't need to go back to try and get records from another dentist. You can imagine that age-old conundrum. A patient comes in to see you. They've got an implant that's been placed in another practice. They'd like you to treat it, restore it, and you're not sure. You have to go through that whole process of trying to find out what that implant is. Imagine the patient just showing you their phone. Having shown you their phone, you then gain access to the records, and having gained access to the records, they're able to find out the implant that they've had placed, and from the implant they've had placed, you're able to carry out the restoration safely and securely. I'm going to bring you back to 1992, to my friend Rob, and his first electronic mail. And I'm going to ask you if what we do now, how are we going to see it in 20 years' time, 20 or 30 years' time? And if that's how it's going to be, maybe now is the time for you to embrace technology in dentistry and use technology and leverage it within your practice to get the best outcomes for your patients. One of the things we're going to say in conclusion is by adapting technology and adopting technology, you can use this to improve, using the virtual patient, your diagnosis, patient understanding and appreciation. You can have shorter treatment times, you can get better surgical and prosthetic predictability, and there's an element of quality control. Okay. Thank you very much for your time.
Thank you, Martin, for your presentation. I'm honest enough to admit